And welcome back. As I told you, Dr. Gabe Kellen and Lori Garrett are still with us as we continue our Ebola summit. I'm now joined by Senators Roy Blunt, a Republican from Missouri, and Democrat Bob Casey of Pennsylvania. Welcome to both of you. Senator Blunt, I want to begin with you. You're calling for a travel ban. There's a lot of, it sounds like the White House in theory would be supportive of it, but they don't know how to implement it in a way that would prevent healthcare workers from getting to the hot zone. What do you say to that?
Well, first of all, we don't have flights directly in and out of any of these countries, so all of our people go through some other country to get there anyway. The question is, do you let people come here from this area that is clearly stressed? And one way to prevent that is just not to issue them a visa. Everybody that would travel here from those countries, no matter where they get to first, before they get off the plane here, they have to have a visa that allows them to stay here. I'd suspend those visas until we have this under better control and have a sense that the carriers they are using are monitoring this in a better way than they have been up till now.
Senator Casey, where are you on this?
Chuck, I don't think there's a medical consensus yet, and I think we've got to do everything we can to ask the medical experts and develop that expertise.
Sometimes a fine line here, right? Is it, if it makes, do you think sometimes you have to do things because it makes the public feel better, even if it's not necessary?
There's no question that there's a great fervor for this, and it makes sense logically when you think about how to stop something. But we've got to focus, I think, on the source of this. You heard in your last segment how severe this is at the source. We've got to stop it at the source. I think with our local hospitals, not just the big medical centers, but every hospital has to try to achieve a measure of almost absolute preparedness. That's why a lot of them are changing. I was at a hospital in Pittsburgh the other day, changing and moving quickly to implement better protective protocols.
You know, you both have toured hospitals in your home states last week. CDC protocols are voluntary. They're not mandatory. Do you think we should make them mandatory for a temporary basis and basically usurp the states on this?
Well, I'm not sure that if you made them mandatory, you'd have a way to enforce that mandatory determination. Hospitals need to be concerned about this. Obviously, the containment hospitals that we've talked about are the place you'd want to have people if you can get them there, but that doesn't stop somebody from walking into a hospital somewhere else. And, we're just frankly not as safe as we were a month ago before you had multiple cases develop in the country. And by the way, Chuck, people didn't get upset about this as long as hospitals were dealing with it in the right way. You had two missionaries come to Emory. They were there. They were cured. I didn't see a single comment by any American saying we're concerned that this isn't being handled correctly. It's only when it's not handled correctly that people get concerned that it's not being handled correctly.
Senator Casey, why don't we have a Surgeon General confirmed? Dr. Vivek Murthy was nominated over a year ago.
It's Washington dysfunction, Chuck. It's as simple as that. We should have one in place, and I think that's part of the problem. But absent that, I believe that we've got to focus on two places: stopping this at the source and making sure that hospitals are doing a lot more drilling. This basic task of taking equipment or protective equipment on, taking it off and putting it on, has to be the subject of constant drilling. In our state, for example, the state health department only requires 2 of those a year, 2 drills a year. That's not nearly enough.
Senator, I'm going to go back to the Surgeon General issue here. There seems to be politics. The NRA said they were going to score the vote, and suddenly everybody frozen. That seems a little petty in hindsight, does it not?
Well, if the president really ought to nominate people that can be confirmed to these jobs, and frankly, then we should confirm them. There's no question about that. But just the normal work of the Congress. Should the
NRA have a say? I mean, they can have an opinion, but should the NRA have that much influence over a Surgeon General nominee? He's not going to make gun policy.
Well, I'm not sure that's why. You'd have to ask Senator Reid why he hasn't moved that to the top of his list to be confirmed. This goes on all the time.
Will you confirm him?
A number of people have been confirmed. Until this came up, frankly, I've heard very little discussion about the Surgeon General. I'm hearing now that the Attorney General nomination won't happen until after the election. We keep putting everything off until after the election, and that's one of the reasons that things don't work.
I want to talk quickly politics of fear. Let me play this montage.
Well, again, the Ebola along with ISIS shows you how we should really secure the border and not be granting amnesty.
Oh, you don't have to worry about this. You don't have to worry about this. Really? Well, the government needs to stop acting as if it's absurd for people to fear a virus that liquefies their internal organs.
Every outbreak novel or zombie movie you see starts with somebody from the government sitting in front of a panel like this saying there's nothing to worry about.
Senators, responsible rhetoric?
No, not responsible. Chuck, I think what we need from members of Congress is constructive proposals based upon the science and medical expertise, not based upon politics. I do think in the Senate, though, I think Roy would agree, I think there's a lot of consensus that our public health system hasn't been invested in, and that we've got to deal with this in a very bipartisan way.
Senator, any advice to people on the ballot in November on sort of overdoing it here?
Well, I'd be careful about overdoing it, but I also understand that if this was one incidence where people thought the government wasn't doing what the government was supposed to do, it would be much less of a reaction than we see now, where there's this long list of the government being one step behind, whether it's the border, the IRS, the Secret Service. Now this health concern is more real than it would be if there wasn't a sense that the government is just not being managed in a way that people would want it to be managed.